Dr. Mathur has said just now, uh, the effect of litigation on medical profession, that is true. But apart from that, the individual doctor who gets it, that is totally different. Because psychological effect of litigation is such a thing that when we start the practice, we never feel that such thing will happen with you and the litigation will come to you. And as a young person, when you are starting the practice, you are very much happy that I am starting ophthalmic practice, I am starting ophthalmic practice. But when the litigation starts with you, you get disturbed because the aims and objects of your is to give the services and good to the patient. But when the patient keeps a litigation on you, then the problem comes. Kajal. So the psychological effect is such a thing that when a notice is given, either from the criminal, civil, or consumer, whatever it may be, or the inquiry officer, as Dr. Mathur has said, there is a notice can come from anywhere. So psychological effect on the doctor is that he is disturbed totally. And this disturbance is not to only him, but it goes to his family. He becomes irritable in the family. He remains aloof, or he is become violent, or whatever it may be in the family. And it is not the only family, but on the patient itself. Because whenever he examines the patient, he comes into the mind that whether this patient will go again to the litigation. And his mind is disturbed totally. Psychological effect is very, very different. And all the patients are affected by that. So, keeping a litigation on the doctor is destroying the treatment of the other patients, actually. So, that happens, but that depends upon the person to person. Variations are there. There are people who are very sensitive and go thinking on that, but some people are very sure that, okay, this is going to happen, I will face, and they are courageous enough to face. So, that attitude should be now there, second attitude, and not the first. Because it is when you are going to do the practice, you should expect that there should be litigation. And anxiety and stress, litigation often triggers intense anxiety due to the uncertainty of the legal outcomes and professional potential of professionals. The stress, the nature that the man, how the person is, whether he is an introverted patient or an extroverted patient, that depends upon him. If he is an introverted patient, he definitely will get the stress. Even for small things, if I have to fly today in the morning, say 5 o'clock, whether I will get up early in the morning, that is also stress. So you are doing the practice and dealing with the life of the people. So lot many stress starts there only for some people. So that depends upon the mind of the person, how he is. That is whether he is an introverted person or extroverted person. So fear of financial loss, including legal fees and potential settlements, that is another thing, but that is a minimal or little bit. Worry about damage to the professional reputation, which can affect reflex and patient trust. So this is a very good, very important thing, because doctor's profession is on trust and his reputation. Trust is reputation. When the patient mouth to mouth says that this doctor is good, it so many people go there, and that is the publicity, from the mouth to mouth publicity, and that was the previously only one source of publicity. Nowadays in corporate, lot many things are allowed. That is a different thing now. Now the medias are there, and you not and so many provisions are there. But reputation, particularly in small towns, in big towns, nobody bothers for anything. In metro cities and what happens where nobody is bothered. But in small towns, it is very, very important, and the reputation affects his profession. The upgrading of the legal proceedings, which can stretch over months or even years. As you know, in litigation when starts, it doesn't stop. Neither the results come out in few days. It goes on years together, years together. And so stress is also taken years together. And so the emotional toll of the being scrutinized and questioned about past medical decisions. This chronic stress man manifests as sleep disturbances, difficulty concentrating, irritability, and even physical symptoms like headache and digestive issues. As you know, psychologists, they know that stress from anything can come. And the professional stress is one of that. And the litigation is on that. Because professional stress is of your practice. But litigation stress is on that. When the litigation is there, you are more stressed. And the man should be enough courageous or extroverted to deal with all these things. Even a baseless lawsuits can help the feeling of the, because the thing is that it is not necessary that actually the fault of the doctor should be there. Because there are many suits put for the sake of getting the money, sake of troubling the doctor, also done by the colleagues to make him bring down his reputation. So in profession, particularly in corporate fields, it is a very, very tough tussle. And the corporate people, what they will do, you cannot understand even. They will put lot of many cases on the doctors or hospitals when there is a good reputation on that hospital. They will make it to put. And another thing is, what is worst thing, I should not say, but it is happening. In New Consumer Protection Law 19, so there is a provision of mediator. And the mediator is given the powers of compromising. So whenever there is a litigation, the person, the lawyers, I am not blaming the lawyers, not anybody, not the patients. But that is the attitude I am blaming. Attitude of the people, not of any profession. They feel that if I gain the money, what is bad in that? So he goes to the patient, says, well, you want money, you have gone to now, you 5, 6 lakhs, 7 lakhs, 10 lakhs. Oh, he says, sign here, that's all, you go. I will not call you. He will go to the doctor. Doctor, your practice is not good, I think. So, well, will you like to have 10 lakh rupees? Just sign, I will put a case on you. You don't worry, you did not come to that. I will manage everything. They will go in the court. We'll put the case from the patient side. That will case. Now the provision is bad. The provision is bad. Every case will go to the mediator. And the mediator will try to compromise. And this patient, he sees how much insurance is, 1 crore insurance is there of the doctor. So we will compromise for 50 lakhs. So both advocates will come together and mediator will compromise for that 50 lakhs and everything is over. So this is happening. This is going to more happen in the future because of the tendency. I am blaming the tendency, not the post or not the profession. The tendency is bad. And if that happens, the cases will increase. The increase premium of the insurance will increase, and ultimately that will go to the patient only. So that false cases are there, and that are more troublesome. Self-doubt, the stigmas of the being use many causes, embarrassment even of the, so other things, hopelessness, the Lengthy and draining legal process can make the ophthalmologist feel trapped, especially if the case affects their ability to focus on work. So the ophthalmologist cannot focus on his work, and everything remains cases on me. The persistent emotional distress can develop into the clinical depression, affecting motivation, relationship, and overall quality of life. So his quality of life is so his professional life is disturbed, his family life is disturbed. So everywhere he is disturbed. That depends upon the person. Again, I will say, and the professional and personal isolation, litigation can lead to both professional and personal withdrawals and ophthalmologist. I am handling, as a chairman of the legal committee of the AIOS, I am handling so many cases on the ophthalmologist. But I only say that you forget that there is a case on you. You start your profession as if there is nothing. That is our thing we will handle. You are not to get trouble for that. And that is the real thing which should happen. The avoid discussion, the case with colleagues out of the fear, actually that should not happen. We should call the colleagues, tell to the colleagues. Distance themselves from family and struggle of the confidence and others. So all this burnout takes place with the person. He becomes so much that this is not good. What have so many people now are not ready to take the medical profession. First thing, they are getting the long medical education, then it is the post graduation, and then settling, and after that settling cases. Better not to go for that. So that is also happen, the defective defensive medicine and all this. So this psychological effect is very high, provided the person is like that, introverted. Thank you very much.
These are what he recounted are absolutely true. All of us have seen our colleagues who have really been suffering for years because of some frivolous litigation which is there. I know an eye surgeon in Delhi who pulled up a fellow of his for fudging manuscripts for journals and creating 5 manuscripts with fictitious names of patients, fictitious patients when none existed. Um, and she went and sued him for sexual harassment. And that case is going on since 11 years. I mean, it has been thrown out in 2 courts, but it is still going on above. So this is nothing to do with patient this, but anyone can sue nowadays, and it really disturbs the life of the doctor. Yeah.
Yeah, really what Quresh said is true. Anybody can sue a doctor. And for the sake of money.
Yeah. Yeah.
Because it is very easy to sue a doctor. Particularly in small cities, it is happening that if the practice is very good, somebody will send some lady to him and she will just go. I have gone through this case. One small case I will narrate here. I will like to narrate this case without giving the names, which I have handled myself in the court. A small town where the practice of the doctor was very good and he was doing very well. And somebody did not wanted that it should happen. And so she sent to the college girls. The college girls gone there. And unfortunately, the they got examination. She sat on the slit lamp. As you know, the slit lamp is having only one rod. And generally it is mounted up, down table. So the legs are there only. The both patient's legs are also there, doctor's legs are also there. So she said that intentionally doctor touched my legs and tried to trouble me. And she gone to, and she phoned to her principal. That was manipulated. Principal came with about 30 students and they started beating the doctor, destroying the hospital. That is actually happened. And so what happened? So doctor phoned to the police and police came and they said that why you have done the, they arrested the doctor and taken. Because that was unmodesty. She said, he has done me unmodesty. So easy. And the case gone in the court, in the criminal court. Then the case came to me. What I seen first, I taken the cameras, and the previous cameras surrounding the hospital showed that the girl was looking after for that, moving around the hospital, seeing what 2-3 days before. That was one evidence. Second evidence was that her principal came within 10 minutes because there was statement that the statement of the girl was that the phone call was also recorded, the phone was also there, and within 10 minutes the principal came with 30 students. The college was 30 kilometers away. How it is possible? So it is a manipulated thing. They were ready outside the hospital. And third, the thing that she given the, say that she has only touched my legs. If the doctor wants to, that is unmodesty do, why only he will touch the legs only? So all these things with the good judgment that they said that this is done with bad intention. So the doctor is totally relieved from that, the broad. But the thing that happened is gone for 5 years. So for 5 years he was reputation gone, his small being small town and his mental torture. So it is easy to torture the doctor very easily anyway.
Any other points for discussion? Yeah, go ahead. Yeah, we have time.
How does the AIOS legal cell help us? Like, how does it function?
Yes, legal cell is there, and legal cell is expected to handle the cases whichever are there on our ophthalmologist all over the India. So whenever a case or a notice even comes, you can send to me. You can go on the website and my phone numbers are there, emails are there, and I help without any charges, without anything to the ophthalmologist till the case is decided. Only the thing is required that one has to put his own advocate in the court, but all the things structure that is being made, because advocates are not knowing the medical profession, so they are not good enough to represent the doctor. So everything I do and hand over to them that they have to do it. If they are insured, insurance advocate will come and stand in the court. So that is, if it is a criminal case, they have to select their own.
What we have done on the AIOS website last year, we have formed a grievance corner. So grievance corner basically comprises of 3 sectors. One is adverse events. If you have any adverse events with your drugs and this thing, we have an adverse events committee. The second is trade relations. If you have any issues with your instruments and any issues with the trade, you can go to that. And there is a third tab, any other. If you just submit your grievance, it goes to the secretary and or it goes to the concerned chairman. The secretary forwards that. If you can go to the website, go to the presidential committee's medical legal cell, contact directly Dr. Deshpande, or you can submit your grievance in the grievance cell and that will be forwarded to Dr. Deshpande, and AIOS helps the members in that way.
The other thing is that AIOS has also started a professional insurance agency called Cover You, which is excellent because it gives you and I would urge every member of AIOS to take, as Dr. You said, everyone should have a professional indemnity and don't go for lesser amounts because people are suing for higher amounts. So the increase in premium is not so much, but try and go for a higher cover even if you are in a smaller town. Yeah.
For AIOS members, a 1 crore policy costs just 6,400 rupees. Whereas in my personal, this thing, for just a 50 lakh cover, initially I was paying 12,000 odd. For 1 crore, we are paying half of what we were paying. It is the power of numbers that matter, a group that matters. this AIOS Suraksha, what we have launched on the website, by just going to that tab, saying putting in an OTP, you have to just enter your membership number. You get an OTP. By inserting OTP, we have 6 policies on the website. 3 for your professional indemnity, professional front, and 3 for your personal front also, with professional indemnity insurance for personal cover, right from 3,200 rupees for a 50 lakh cover minimum this thing. You can take up to whatever amount you want. For hospital indemnity, you can take cover. And there we have a policy called Cover Prime that includes medical indemnity plus social media intimidation, legal notices cover, all sort of assistance. So there is a prime policy also. And on your personal front, you can approach the intermediaries that is cover you for your personal health insurance. That also matters, apart from your professional safety, professional health insurance, your personal health insurance, then your term life insurance. We do have FBS. Dr. Quresh is the chairperson for the FBS Society, but there is an age restriction of 49 years, whereas now we are offering term life insurance for, especially for people over 49 years, up to 60 years of age. If you are interested, you can offer a term life insurance, and then including your motor vehicle insurance also, they are promising a 25 to 30% discount on the existing premium that you are paying. And what they are also offering is up to 4 motor cars. Like some of us well-to-do colleagues, you may be having more than a vehicle, and in a single policy, they will cover all your vehicles, up to 4 vehicles. So it's a comprehensive thing. All 6 brochures are uploaded in the website. You just have to fill a form. And what they are offering as a incentive in the initial thing is, just if you fill your form with all the particulars, so they are going to provide you a complimentary 10 lakh insurance cover. After that, if you pay them and take a, suppose, a 1 crore cover, for the first year you will get 1.1 crore cover, something like that. So that's an incentive thing. Basically, it's a good move with a good intention. And I would request all the AIOS members to make use of this facility, as Dr. Quresh said.
Yes, please.
Powerful than written consents?
Yeah, video consent, but consent should be in writing, and that can be catched in the video, that the person is being told everything, explained everything, and is signing. That video is important. That is definitely having the weightage, but that should be in hard copy only, signature and thumb impression.
And consents should be taken day before surgery or on the day of surgery is also valid?
It is not necessary day before.
On the day of surgery?
On the same day also. Yes, please.
Yes.
Yeah. Yeah.
There's not I mean, most of the time, the respect that is standing between a teacher and a student.
Yeah.
That's what I said. Health care is transferred to corporate law now. Corporate care.
Sir, I have a suggestion. Like, the whole fear is because we don't know what is going to happen. It is about the unknown, because as doctors, we don't know anything about the legal field. So if we have a kind of a flow chart that if this thing happens, then this is the next thing you need to do. These are the options. Then
Yeah.
like if there is death on table, we don't know that the police cannot arrest you. So there should be a flow chart, so we know that they cannot arrest you. Then the local police comes into picture. Even if you are arrested, then the magistrate comes into picture, then the lawyer. So like, if we have learned so much, we can learn this also. This is not too much. It is only the fear of the unknown which is scary.
The medical legal cell is now doing that work of that, and we are preparing SOPs for everything. That is patient coming from the outside to the counter to he is discharged and follow up. So for every SOP, for every function, that is this happens, that happens, that happens, surgery, medicine, examination, whatever you want to do, we are preparing SOPs. The process is going on. So shortly, we will be publishing that SOPs on our websites are also as in the form of a booklet, and that will be available too.
It will
So,
be on our
yeah,
website also.
so we are working, and so many experts are working on that, because some surgery will be expertized by somebody, and that he will suggest the SOPs and like that. But it is doesn't mean that these SOPs are binding to the ophthalmologist. Neither they will be any effect on the court, as this was the SOP, why you had done like that. That cannot be used in the court of law also. So that is also we are making the provision.
And
so
one
like
more
if it goes
announcement.
to the consumer court, then whom we have to approach? We don't even know where the consumer court is.
Those
Yeah,
SOPs will.
Things like that.
that is
If
my
it goes
India's,
legally, then where? If it goes to the state medical council, then where we have to go? Like
yeah,
after that point, we'll try to find out now what we have to do. If we
yeah,
know that beforehand, then it is
yeah,
easier.
legal
It's
cell,
coming.
legal
It's
cell,
coming.
yeah,
Asking
yeah,
exactly is
yeah,
what
it is
happened.
coming, it is coming.
Okay.
And you, at present, if anything happens, you can go approach to the legal cell, AIOS.
And one
By
more
phone
announce-
also, even, by only giving the phone.
And one more announcement I would like to make. Last year we had a very successful certificate course from AIOS called Discourse, that was covering infection control. So shortly, probably, sir, in May or June, we will be launching a medico-legal certificate course for AIOS members. There will be 10 modules, 10 lectures with online examination, and all the members who clear that online exam will be awarded a certificate of appreciation for AIOS on medico-legal aspects.
So everything is ready for that also. Only after the conference we are going to start
Because
immediately.
we need 10 uninterrupted weeks of tuitions.
Yeah.
So the topics are ready, speakers are almost ready, so we'll be launching it very soon.
So,
Thank you for that, sir.
Last
yeah, yeah,
question.
please,
We
yes,
have
please.
time.
We are having time, no problem.
What I understand from this is that only the informed consent holds true in the court of law. So what we write in our OPD, we keep writing risk of this, this, this. Are this not required, and where does this stand today?
Yeah, that is true. The informed consent has given more importance in the criminal law, in the new criminal law. That is true. In consumer, informed consent is not going to give the protection at all. Whatever he has accepted, he is a consumer. So consent is nowhere giving protection to you. Only the time that he has allowed to do it. So there is no weightage in the consent in civil cases, but in criminal cases, lot much. The OPD, whatever you write, actually nowadays the national NMC has given the direction that all the records of the patient should be in media, that is a type media, that is in software, so what is called as a computer media. Yeah, so that should be recorded in that. They have given even the instructions that the old record should be converted into soft media. Yeah, within 3 years from their order, and 1 year has passed. So after the 2 years, that it has become a compulsion by the NMC that it should be written in the soft media only. You should not write. Actually, medico-legally also, you should not write anything on the OPD case paper, because whatever you write on the OPD case paper, that goes to the patient, that goes is the court. And if by chance you written something which is against you, that is used against you. Particularly, our doctors are having the writing of question marks, question marks, question marks. So this is corneal infection, question mark. This is keratitis, question marks. This question mark. And these question marks, we understand these question marks are differential diagnosis. It is not the question that is bind. Doctor is confused. But the advocates of opposite side say that doctor was confused. He was not knowing anything. He was not knowing the diagnosis. He was not knowing even the treatment. So he was confused. So he has put the question mark.
Provisional.
Yeah. So never put a question mark on your inpatient also or outpatient also. But whatever things you have to write, you write to your hospital record and nothing on the OPD case paper except treatment and the follow-up. Follow-up should be very good written on that. Next date, emergency dates, and the phone numbers and even personal phone number of the doctor.
In the EMRC, it is always written there is no question mark. It is a provisional diagnosis. So even if you are mentioning it physically,
Yeah.
better mention it as a provisional
Yeah,
diagnosis
writing
rather than
provisional
putting a question
diagnosis.
mark.
No question marks.
The important thing is don't give your case records to the patient, OPD case records. In my clinic, the patients ask me for my case paper. I said my case paper is in handwriting because I don't use EMR as yet. My handwriting, sometimes even I cannot read. So it's impossible for you to read. Instead of that, you just wait for 24 hours. I'll give you a printed case summary. So you can give a printed case summary in which you can write whatever you like and give it to them rather than a case record with P equals N, which in my languages, pupils were normal. So P equals N is, if I give it to him, he's not going to understand, neither his advocate will understand. So better not to give, because they said, sir, we got a mobile phone, I'll just click. It's so, I said, no, sorry, you will not just click because you won't follow. I'll give you a typed report which you can use. Yes. Yes. No, exactly. Never give your worksheet to the
Actually
patient.
speaking, there are programmings also. Programs are available. Lot many softwares are available for hospital, and that can be made tailor-made also. As you like, you can make your software tailor-made and put a operator by the side. You just go on dictating and she or he types it and it goes to the computer. And in the last, only the prescription comes. Whatever you say, the prescription comes out and it becomes very easy. And nowadays, after 2 years, it will be mandatory because NMC wants that. NMC don't want the prescription should be in handwriting. And if it is in handwriting, it should be very, very clear. Yes, please. Follow up, with follow up. Yeah. No, no, nothing should not be given. I will say,
As it is his right to have a case summary.
yeah. If he applies for case summary, you can give the case summary.
No, you have to write the case summary.
Yes, yes.
Yeah. Yeah, yeah. Unless they require and apply. Whenever they apply, within 72 hours, you have to give that. That is their right.
You can't charge.
And you cannot charge for that.
You cannot charge. You can charge only for photocopy charges. They can't charge. Legally, you can't charge. I'm pretty sure. Yeah. If you see American doctors' reports, they write 4 to 6 pages of gibberish for a conjunctivitis patient, but it's that thick. They don't write the essence, but it's all covered in so much of junk that you can hardly decipher.
Yes, please.
Yeah. They're not supposed to, you can stop them. Yeah. What can you do without knowledge? If you come to know, you can stop it.
If you do a slim Janet stuff here, but probably the patient will not come.
Yeah.